recording us. All right, so welcome, Kimberly, to It's All Speechy.
Thanks for having me.
Yeah, thank you. So we have Kimberly here, and we are going to talk about the deaf and hard of hearing kiddos that we see a lot as a speech therapist. Just going through, especially when they're younger, going through that process of building their language. And we're going to go over today some misconceptions that a lot of people have in regards to this population. So I am super excited because I probably fall into some of these misconceptions. So I'm ready for you to set me straight. So Kimberly, to start off, can you just kind of say who you are, what you do, kind of how you got to where you are currently?
Yeah, sure. So I'm a speech and language pathologist. I think where I started on this journey was as a young child, being raised in a trilingual household, and I was being really fascinated by language.
What languages?
French and Italian were the other two.
Oh,
and English.
Oh, wow, that's amazing.
Yeah. So I've always been really interested in linguistics and how languages work, and I've always wanted to learn more languages. And so when I was in undergrad, I started learning American Sign Language, and then I went to Gallaudet University for my master's program, which is
amazing.
So I was immersed in ASL and fell more in love with it. And so I think that very early exposure to different languages kind of led me down this path of becoming an SLP and being fascinated by language, and then eventually learning ASL. And so now I worked at a school for the deaf for 9 years, where I did my language therapy in ASL, and now I'm actually just doing language first full time and helping advocate for early accessible language for deaf and hard of hearing kids.
Oh wow, that's amazing. I did undergrad. I did 4 semesters of ASL, so I have enough to get by with the early intervention kiddos. I would love to do more with it, especially I think with the kiddos I'm really good, but it's I need to move more into the older kids or adults where I can really, like you said, immerse yourself in it. And going in a deaf going in a deaf school, that's amazing. Was it 100% deaf students, or was it a little mixture? Or
their undergrad population is 100% deaf. They do have a handful of hearing undergrads. They call them hugs. But very, very, very few, like a handful. And then it's a graduate level. It's about 50% deaf and 50% hearing.
Oh, wow. Okay. So then that would be more of those individuals that are hearing, wanting to immerse themselves into ASL and bring that into their career. Yeah. Oh, that's awesome. So this is a little side question. So for individuals like me, trying to get better at ASL and using it to become a little more fluent, do you have any recommendations? I mean, I know immersing yourself, I feel like any language, they're immerse, that's where you learn it. Is there any other tips and tricks you have for learning new signs? I know there's a ton of websites that have ASL signs. I don't know if you have preferences of ones that are more accurate than others.
Yeah, I'm glad you asked that. So Gallaudet University has a program called ASL Connect. So if you just type ASL Connect into their search bar at Gallaudet, they have some free online courses and some paid online courses, and they're more geared towards professionals, adults who are trying to learn more ASL. But on our website, on languagefirst.org, we also have a list of places that we recommend learning ASL from, because we do recommend learning from a deaf adult, not from a hearing person. Because deaf adults are the ones who are native users of that language, and it's their culture, and so we think it's really important to learn from them. So feel free to check out our website, languagefirst.org. We have lots of resources, but we also have a list of places to learn ASL.
Oh, that's perfect. Yeah, I know. I had when I was in undergrad, I had one semester where I had a hearing individual that did my ASL 1 class, and then I go into ASL 2, and this individual was deaf, and I had a minor panic attack. I'm like, oh my gosh, like, do I know enough words to like make it through? And like, I went through 4, I survived, like, I learned a lot. But yeah, and I feel like even like the professors too are just so much more patient. Like because I mean, they know there's like that language barrier of not being able to hear if we're asking a question. We have to somehow get the question out either via the signs that we do know or even writing if we need. And they were fantastic.
Exactly. Yeah. And that's true immersion, right? Like you have to figure it out. You have to figure out how to communicate with that deaf professor.
Yes. Oh, for sure. Oh, that's amazing. So kind of going in, so obviously we're speech pathologists. We work with individuals with hearing losses of all kinds. What is important to understand between like hearing and communication? Like what's kind of the big takeaway of why is this important that we should be learning more about this population as speech pathologists?
One of the big things I think is this idea that as SLPs we feel like we have to fix things or make them better or make them more typical, and you can't see me, I'm putting typical in quotes.
The quotes all over the place.
Right? So, but instead, if we think about it as, they just use a different language. They just communicate in a different way than we do, and that's okay. And we don't necessarily have to fix them, but try to provide them with communication strategies or, ways to make them more independent so that they can live a full life and function in this world. So encouraging SLPs not to think about hearing loss so much as a deficit or something that we need to fix, right? But instead of thinking of it as, oh, this kid uses a different way of communicating or uses a different language, and so how can I help foster that in them? And how can I help them become the most kind of independent and functional and happy person that I can? So it's a bit of a mindset shift.
Oh, for sure. And I think it's even, that's important for us to know, but as well as families, like for us to be that advocate of like, I know there's a lot of families that are like, oh no, like they have a hearing deficit. Like we need to go for the, excuse me again. We have to go for like the hearing or like the cochlear implants because then they're going to be able to hear. And it's like, that really shouldn't be the mindset going in. Like, oh, we have to do these things so they can hear and, quote unquote, be typical. And where I think if you have the motivation and you have this child that uses ASL, like, you have that motivation to learn. And I think that's kind of the hard thing, too, of like, oh, no, we have to learn another language, like, for a child. And I recently had, I guess it was like last year. So I had a family that there's no hearing loss. There's just a really, like, he turned 3 when I was with him, so he aged out. But he had like 10 words, just very language delayed. And we were focusing a lot on ASL because that is what he would like use. And it was so fun talking to the parents because they'd be like, we have the whole family, like his cousins will come up and like sign more to him, or like they'll ask like the parents, like, how do we do this sign? And I'm like, this is amazing. Like, I could be bummed that like this kid's 3 saying 10 words, but like the fact that he's using ASL to communicate with parents, with outside family members, and that this family was so like supportive of it, of like, yes, like we're gonna learn ASL too. And I was like, oh, my heart, like.
That's awesome. And I think parents don't realize how powerful that is for their child to see that you as a parent and your family members and extended family members and cousins, that you are all saying to this child, we accept you and we're going to find a way to communicate with you. It doesn't have to be my language, it doesn't have to be my modality. I'm going to adapt to you because I care about you communicating. So just by doing that, they have told their child essentially, we care about how you communicate and we want you to be able to say what you need to say. And it doesn't matter if you're using English, Spanish, American Sign Language, British Sign Language, it doesn't matter. We just want you to be able to communicate. So that is amazing, and it's so powerful. I love that.
It is. And I mean, even for this kiddo, like there wasn't any barriers. Like it wasn't like, oh, he doesn't wear his hearing aids, so we focus on it. It was more of like, yeah, like this is how you want to communicate with us. We're going
Right.
to support them. We're still going to talk to him. We're still
Yeah.
going to verbally label everything we're giving him, but we're also supplementing that with his language so that he can, like you said, like feel seen, feel appreciated, and like now that you've formed that kind of bond, like give it a year and you might see a ton of progress too.
Exactly. Yeah.
Mm-hmm.
Love
Ah,
that.
it's so fun.
That's
So misconceptions. I know we have a couple misconceptions that we kind of want to hit at. The first one being like reduced hearing causes a language delay or disorder. Kind of tell me
yeah.
more about that.
Yeah, that's a good one. And I think a lot of people listening are going to say, what? Of course it does, right? Like, that's what we learned is that it causes language delay or causes language disorder. But if
Mm-hmm.
we think about it this way, there's nothing about reduced hearing in and of itself that changes the brain's ability to acquire language, right?
Mm-hmm.
You cannot hear a single thing your entire life and still acquire language absolutely fluently and right and not have any issues with language.
Yeah.
So it's not a direct correlation. It's not a causation, right? It's not that just because you have reduced hearing, therefore you must have issues with language because it causes issues with language.
Mm-hmm.
Instead, it's the accessibility to the language. So if I can't
Yeah.
hear the
Oh, good
language
point.
around me, I may struggle to acquire oral language, but I may
Mm-hmm.
not struggle to acquire a signed language. And oral and signed languages are the same. They're equivalent. They're equal, right?
Yeah.
And so if we say that reduced hearing causes issues with language, then that's not accurate because it doesn't cause issues with signed language. And so
Mm-hmm.
we have to make this distinction between the ability to perceive sound and produce speech and the ability to understand and use language no matter the modality. So I always
Yeah.
try to challenge people on that. I'm like, well, was it their reduced hearing that really caused that, or was it the fact that we didn't give them an accessible language, right?
Mm-hmm. Oh, for sure. I mean,
Yeah.
yeah, if you sit and like compare that to like TBI or aphasia, where it's like that's an actual structural issue that
Exactly.
you are reforming, you're recreating, or not recreating, but like working on to help them form that language as
Right.
well as they can. Where
Right.
this, yeah, like you said, like everything in there intact and good
Good
to
to go.
go,
Yep.
but it's
Exactly.
giving them that platform of like, okay, we're not going to do oral, but here's a sign, and you can pick up on the pragmatics. You can pick up on the
Yep.
social communication, all like the semantics. Like, well, I think ASL has a little bit different semantics
Yeah.
than
That's
oral,
okay.
but it's like they have that, and they can still
Yep.
communicate if people give them the chance. Like,
Exactly. That's why
mm-hmm.
I always tell people it's more about what us as the adults in that kid's life are doing, right? If
Mm-hmm.
we're not giving them what they need, that's not an issue of their brain not being able to acquire language. It's an issue of us not giving them the
Yeah.
language. So
Mm-hmm.
that every single deaf child is born ready to acquire language just like a hearing kid.
Mm-hmm.
And what we do with them as adults is what could potentially, impact their language acquisition. So
Mm-hmm. Oh, for sure. Yeah, I ran across on Instagram this family. Oh, what was their name again? It's like It's Our Signed World or something. And it's
oh
like a
yeah,
hearing mom, a
yeah,
deaf dad with their little daughter. And I like my heart burst and I'm like, I need to follow them because like
yeah.
their interactions, especially between the dad and the daughter, and she like the most recent one I saw was them like watching football. So he was like signing to her, like, oh, I'm watching football. And
Yeah.
she kind of like looks and she's like, and
Yeah.
he's like, yeah. And I'm like, see, she's like 3, 4 years old. And like, because they're providing that to her on a daily basis, all day, every day, it's easy for her now. She's like, oh, like this? Yeah, of course. Like,
Yeah.
it's amazing. The second one, so a deaf or hard of hearing kid with clear speech must therefore have great oral language.
That's another good one.
Yeah.
And this, I think, goes back again to that distinction between speech and language. So,
Mm-hmm.
somebody who speaks Japanese could say a Japanese word to me right now, and I could repeat it back to them, maybe even with a really good accent, right?
Yeah.
But that does not mean that I know Japanese. So, being able
Mm-hmm.
to rhetorically produce speech speech with your mouth is not necessarily indicative of your fluency in that language. Same with ASL, right? If I could articulate a sign, right? And for those of you listening, you can't see it right now, but I'm putting my thumb right up against my middle finger in a really articulate and precise way. I'm articulating a sign right now. If you don't know what the sign means, then what's the point of being able to do that, right? This is a motor skill. And so if you don't know that this is the number 8 and you don't know what 8 is and you can't count to 8 and you can't do math with the number 8, then being able to articulate the number 8 is not helpful. So I think what happens with deaf and hard of hearing kids is that we assume that because they can articulate a word in English or Spanish, that they must then be fluent in English or Spanish, right? And so being really careful to separate out, like, is that actually language or are they just articulating oral words?
Yeah. Oh, yeah, that's a good way to put it too. And I mean, even like my boyfriend speaks Spanish. So that's another thing I'm trying to learn to kind of really embrace all the languages. And I mean, sometimes it's harder. Like you have to try a couple times to like figure it out. But it's like, yeah, if he says a word and I try to repeat it, and he's like, yeah, you said it right. And I'm like, okay, great. What does that mean?
I don't know what it means.
What's the word I said?
Exactly.
Yeah, I think that's like a big thing is like people think of all these different languages and I want to learn a language and do this, and they don't think of sign language, but it's like it's literally in the title that it is another language. So the fact that people just kind of blow over it and are like, oh, I'm going to learn another language, Spanish, French, and I think that people don't do ASL because they don't think it's widely used. So they're like, why would we I mean, yeah, right now Spanish, very prevalent. Like I'm in Las Vegas, Nevada. It's very prevalent here. So in those situations you do, but I think ASL, if just like one person like everywhere starts learning these things, it just is going to be so more widely accepted too.
Absolutely. And I hear that kind of being used as an excuse, like as to why deaf parents shouldn't sign with their kids. Like, who are they going to sign with? Well, ASL is the third most used language in the United States.
Yeah.
And there are hundreds of thousands of people that they could use that language with. So it's kind of a weird argument, right? It's being like, that would be the same as being like, well, why would you teach your kid German? Who are they going to talk to in the States? Yeah. Well, they could go to Germany. They could find, there's so many different ways you could use the language. That's not a rationale to not introduce the language to a kid, right?
Yeah.
So I always found that kind of funny. Like, who are they going to sign with? Lots of people, actually.
Well, and I feel like the deaf community is one of those, like, they love their community. From like what I have witnessed when I did like my undergrad stuff and had to go to like these events, like they put on whole events, like everybody knows each other, like they don't know who you are, but they're coming up and talking. Like I think that's one of the languages that's like very arms wide open. Like we want you to learn this and we want to teach you this, and we love our people and we love like supporting that. And if people don't teach their child ASL because it's not relevant enough for them, quote unquote, that's kind of the frustrating thing, going back to like the family I worked with where the whole family started learning. And it's just like it's that easy. Like I mean, not easy, everyone's going through the learning curve, but you're doing it together. And I think that's like the best part, especially for that child, to be like, oh my gosh, like my cousin Johnny just came up and signed with me, like, oh, what? And oh, for sure. How about only kids with profound hearing levels need ASL?
Yep, I've heard this one a lot, especially from SLPs, unfortunately.
Oh no.
Where they'll say that if a child has, let's say, mild to moderate hearing levels, that they don't, quote unquote, need ASL, implying that ASL is only for people who really can't hear much of anything at all, right? Which, again, doesn't make a lot of sense because it's the same as saying, like, someone who doesn't live in Germany doesn't need to speak German, but you can learn any language at any point. You don't need kind of prerequisites and rules as to when and why and how I'm allowed to learn a language. ASL is a full language for deaf kids, and even if they have mild hearing levels, they will still benefit from a visual language because they're still going to miss out on that oral language input, right? They're going to mishear things, misperceive things. Maybe their hearing aids are off that day, the batteries are getting charged, whatever the case is, right? Their dogs chew them in the laundry machine. So there's going to be times where it's going to be beneficial for even a kid with mild hearing levels to have access to ASL. And even thinking about like in a classroom situation, trying to take in academic content through your weakest sense, right, through your ears, and it can be really, really taxing, right, to try to take in this information and learn it and hear it and perceive all of it, and when there's background noise and you can't see the teacher's mouth and you need the visual, and you so many situations where it would be beneficial to also have it in another language, like if you had an interpreter, right, or if your teacher signed. And so that assumption that just because they can hear a little bit that they therefore won't need this visual language is kind of a grand assumption, right? Like you don't know. What if they really do benefit from ASL? And what if they really find it helpful to have visual access to the information as well? Right?
Yeah. Oh, for sure. Like what kind of comes to my mind is like, for those of us that are hearing, like if we have like earbuds in and like someone says something, like whether we have music on or not, it definitely affects our ability to hear. And like the nice thing about that is we can be like, oh, 1 second, pull it out. And then they say it again and you're like, oh, I got it. I'm good. Where it's like, yeah, no matter what hearing level they have, they have those earbuds in. They have earplugs in that leads them more to like that moderate level. And I don't know if these are good good references, but yeah, I think it's just so interesting how much they tie together, but also how little like SLPs know about how they tie. Like I have a client right now that they recently moved here and they were like, yeah, we talked to a couple SLPs, but everyone's kind of saying like her hearing isn't affecting her speech at all. And I was like, interesting. Like this girl, she's like 3.5, really no words. I mean, she has like words that mom and dad know, like, oh, that yell means no. And I was like, oh, okay. Yeah. I would have never known, but good to know. Like I've heard her say one word. But yeah, and they're going through and they're like, oh, yep. So we went to like the audiologist, and the audiologist said that neither of her eardrums are working. And now like she recently has tubes put in and like they're making these steps, and I'm like, and there's speech therapists that are telling you, no, keep working on speech because the hearing doesn't matter. I'm like, what? Hold on a second.
This kind of goes back to what you were mentioning earlier about how you had maybe 1 or 2 classes on maybe oral rehab or deaf kids in general during grad school. And I think that's most of our experience is that we have a very wide scope of practice and we have to learn a lot in our 2 years of grad school. And so it makes sense that you only have 1 or 2 classes on each of these topics, right? Yeah. And most SLPs graduate from master's programs without being really, really competent to work with deaf kids. It's such a small population. There's very few of us that actually work with deaf kids. And so, of course, it's not going to be a huge area of focus in our graduate programs. But I think it's important to be able to admit, like, oh, I don't know about this, or I'm not sure about this, or I'm going to have to refer you to specializes or something, right? Because it's true. Most grad programs, just by nature of how much we have to learn, don't focus a whole lot on deaf kids. So yeah, I'm actually not surprised that other SLPs are telling them that.
Yeah, like, I mean, yeah, now that you say it, I'm like, I don't think, like, in grad school I had anything. And, like, what I had in undergrad was just, like, you were going to hear the word hearing aid. Like, this is what it looks like. Like, this is the on button. This is, like, if you look at an audiogram, here's how to read it. Like, and all of that kind of stuff. And I'm like, okay, like, I don't really use any of that right now, and I do wish in undergrad or grad, whatever is available, like they kind of went more into like, okay, like hearing and speech, how is it relevant, how should I be like providing therapy to these kiddos that have that barrier instead of, okay, great, I can like look at their hearing aid and turn it on, perfect. But like that doesn't help me. I'm not going to work with their decibel levels. I'm not going to do any of that kind of stuff. Besides, like a couple families, I've provided graphs of like, okay, like the audiogram, like it says this is what your audiologist has said. Well, here's like a graph that kind of shows you, oh, your kid can hear these sounds, but these sounds are really tricky. So if you hear something high pitched, like a bird chirping, they won't hear that, but this kid can hear a truck horn or whatever it might be. And yeah, I think it's just so important to know how those two work and correlate with each other. Because to me, I'm like, it's mind blowing. But I mean, maybe I've worked more with children. Because I mean, when I was in early intervention, I actually had quite a few kiddos that were hard of hearing. So I don't know, maybe I'm more experienced in that field than I think I am when I'm like, oh, I had like 6 kids. Like, that's it. But I guess there could be other people that are like, I've been working this 30 years and have never worked with a child.
Yeah, exactly.
Mm-hmm. Oh, for sure. Let's see. Next one, learning ASL will prevent deaf or hard of hearing kids from learning oral English. This one I have heard a lot too.
It's a common one, right? And you hear it with other things too, right? Like, oh, introducing them to AAC is going to stop them from talking, or introducing them to Spanish is going to stop them from learning English. You hear it with all these other modalities.
Yes.
None of it is rooted in evidence. There's absolutely no evidence that introducing a child to any other language or modality or way of communicating is going to stop them from using insert other language here, right? And for the most part, it's oral English just because, you know, in the U.S., we have a lot of English speakers. But there's actually evidence that these other languages facilitate the learning of oral English. There's evidence that kids who sign ASL from birth do better on tests of oral English as compared to kids
incredible.
who don't sign from birth. Because the language builds language. The languages all interact with each other. It's all processed in the same part of the brain, even if it's a signed language. So by providing them input in another language, Spanish, ASL, even AAC aided input, you are building that part of the brain that's eventually going to transfer to their ability to learn and understand and read English. So it's almost the opposite, right? Like we should be recommending that they introduce kids to more languages because it's all going to help, right? All of these different language inputs are all going to help.
Oh, for sure. Yeah, it's like the question that like makes my heart break the most when I will go into like families' homes, and again, early intervention because it's what I've done the most of. But these families are like, oh, my child's delayed. Like, we really want them to know English because it is very prevalent, and like we want to focus on that. But we also speak Russian at home, or we also speak a version of like Tagalog or whatever it might be, and they're like, oh, maybe we shouldn't do that because that might be like affecting. I'm like, no. And and I guess like I'm never like, oh yes, teach them other languages, but I kind of present it to them as like, yeah, there's no research that says your multiple languages are not helping your child. If you as a parent, if that's too overwhelming to teach your child 2 or 3 languages, I can't tell you to do that. Like, if you want to just focus on English, you sure can, but like I'm here to show you that like doing your home language and English and teaching your child both of those, that's not the reason for the language delay. Like, you can't put those together. But if you do choose like just to do English because it's more relevant and prevalent and that's what you think you have time for, then go for it. I'm here to support that. Like, I'm just here as a support. So whatever you choose to do, I'm here. But it's just providing that knowledge of like, no, it's not just because you're speaking Spanish at home.
Yeah, exactly.
I know one thing. I don't know your ideas on this, but like multiple languages where some people will be like, yep, we speak like Russian at home and then school's English. Like, is that a good idea, or is it good for parents to do the English and Russian at home and then the English at school? Or I don't know. I've heard that it's like good for kids to kind of know, like, I'm going to get Russian at home and English at school, but I don't know how accurate that is.
Well, I think it depends on what works best for the family. So we talk a lot about like language planning for families and how they can kind of essentially plan out like these are the moments where we're going to use this language, or these are the time frames where we're going to use this language. Or maybe, like you said, because they're getting English at school, then at home we're only going to speak Tweet. And so whatever works for that family is going to work for that family, right? So it's kind of like thinking about what, you know, who speaks those languages fluently. Let's say your husband speaks Russian, but you speak French, and so maybe you speak French with your daughter, and your husband speaks Russian with your daughter, but then your daughter gets English at school. So you can kind of plan out, like, where are we going to use these languages, and with who is she going to use these languages, to try to give her as much kind of input in a variety of languages as possible. So definitely kind of whatever works best for the family. If they want to do it by person, like this person speaks this language with the kid, or if they want to do it by like location, right? In the kitchen, we only speak Italian, right? Growing up, we always spoke Italian in the kitchen. Or like,
I love that.
Or like by time, right? Like for the first half of the day, we speak French, and the second half of the day, we speak Spanish, right? So whatever kind of works for your family. But I also encourage people to code switch and make it fluid, right? Because even my experience growing up was that depending on who was in the conversation, we might within the same conversation switch between languages. And that's okay too. You don't have to be like, oh no, this is English time, we cannot speak French, right? You can kind of naturally have this flow and this switch between languages that just works for whatever group of people is talking together in that moment. So lots of flexibility there for sure.
Yeah. Oh yeah. I love it that you brought up like code switching, because I feel like in school, that's like one of the things that's like, oh no, like they're code switching, like it's normal, they're learning, but like once they learn, like they won't do that. Like, we should be very open to just like code switching and having, I mean, I do lots of Spanglish. Like I know this much Spanish, so I need to substitute some English. But then that's also where I learn too, where it's like, okay, I can say this. Oh, stuck on this word. Oh, dog. And then that's where like the Spanish speakers can come in and be like, oh, yes, obviously, like here are the words they're looking for in Spanish. And I'm like, great. Add it to my list over here.
With my deaf kids, like if I'm doing a session with a student who has really good, you know, hearing or makes good use of their devices, maybe I'm doing my session in oral English, but if the kid doesn't know the word in English and they respond in ASL, awesome. Like, totally fine, right? Because they're showing me that they know it just in another language. So then I might expand, or I might tell them what it is in English, or vice versa, and you're empowering them. You know, like, you know more than one language, so use them to your advantage. If you don't know the word in one language, speak your language, and I'll help you out. I'll give you what it is, right? So, making that code switching, kind of normalizing code switching, right, and making it something that is okay to do.
Yeah, I think that from this podcast, like, I'm just like stars all over the place of like making that normal, because I think going in, and I mean, even schools probably to this day are still like, okay, one language, we're working on these, like, and just being like, you code switch, but that just means that you know so much more than you think you do, because you have dipped your toes in all these other languages that you can use to support. And like you said previously, like putting those words in there, like it's helping your language in all your languages if you code switch and do those types of things. And I think, we kind of have to get out of that mindset of like, okay, everyone needs to verbally speak. Everyone, like, we have to, or even like AAC, like if you're on AAC, you can only use your device. And it's always like, oh, you can't point, you can't. And it's like, okay, we need to embrace these.
Yes, because this morning I gave a presentation and we were talking about this resource that we created where you could essentially plan out in a kid's day. This was for deaf kids, but it could work for anyone. You could say like, okay, during this period, because of the students in this class and someone's coming in, let's say the SLP is coming into this period, this student is going to receptively take the lesson in ASL and oral English and receptively respond via AAC. And then maybe in the next period, they're taking the lesson in through oral English, but they're responding in ASL. And then the next, right? And so you see how you can
Yeah.
change receptive and expressive language like from period to period, from moment to moment, right? And so it doesn't have to always be like I tell you what it is in English and you have to respond in English, right? Like no, you
Yeah.
can respond in whatever works in that moment. So
Mm-hmm.
yeah,
Yeah.
that's awesome.
Oh yeah, especially with kids too. It's like giving them just kind of that foundation of even different
Yeah,
languages. Because I
yeah,
mean, like we've said multiple times, families won't do it because it's not relevant to their life and it's not. They don't have people around. But it's like if I were to have learned ASL as a child and grew up, like maybe I would have gone more and maybe I'd become an audiologist because
yeah,
I just really care about that community, or I obviously do care about the community,
yeah.
and but just didn't take that track of like, oh, like I know this language, like I can hop in and like do something within that community, and so it's kind of just helping give kids the option too of yeah, if they want to go to Germany, well, they can speak German now,
There you
so
go.
they're gonna go, and like it's not gonna be this big like oh my gosh, like I have 6 months to learn German.
Yeah,
But
yeah.
yeah, it is so important. How about deaf or hard of hearing kids with hearing aids or cochlear implants should focus on learning to listen before they learn to sign?
Ooh, yeah. The biggest kind of issue I have with this recommendation is that the critical period for language acquisition applies to all languages. So if
Mm-hmm.
we're going to focus on this critical period where birth to 5, we're really going to focus on oral language, and it doesn't work for whatever reason. They can't fully perceive the language, they can't fully hear it, and so they don't acquire it.
Mm-hmm.
Now we've missed out on the critical period for a sign language. So
Yeah.
now we have a kid who is 6 years old, let's say, and they didn't acquire oral language fluently because they couldn't really hear it that well, and they also weren't given a signed language, and so now they don't
Mm-hmm.
have an L1. They don't have a first language. So
Yeah.
instead, if we give them everything from the start, so that
Mm-hmm.
that critical period, those first 5 years of life where our brain is really, really, really plastic, they're able to have access to all of these different modalities, and we can kind of see which one, if not multiple ones, work for that kid.
Yeah.
But if we're going to just focus on one, then we're also missing the opportunity for those other languages to kind of be acquired during that highly plastic period.
Mm-hmm.
Uh,
Oh, for sure.
so yeah, just thinking about kind of how the critical period applies to all languages and not just oral languages.
Yeah. Oh, for
Yeah,
sure. Yeah, I know.
yeah,
So I guess your recommendations. So let's say I have a family, they come in and they found out that their child has like a moderate hearing loss, but they're like an infant. How would you like if I'm going through like 2 years worth of therapy with this child?
mm-hmm.
How would you go about that? Would you just sign to them for the first couple months and once they're actively participating, like hand over hand, or wait for them to just mimic, or what's the best way for us to work on
I
that?
I personally would, from the start, let's say I start working with this family when the kid is 3 months old. Okay, they just
Mm-hmm.
found out that they have moderate hearing levels and they got them hearing aids.
Yeah.
From the start, I would myself provide both languages because I happen to also know ASL,
Yeah.
but help the family acquire services from other native signers, right? So like, can we get them a deaf mentor? Can we get them in some sort of programming, like a parent infant program at the local deaf school where there are deaf native
Mm-hmm.
signers who can sign with this baby? And then helping the parents learn a little bit of ASL too, but also teaching them strategies as to how to use their native language with their kid too, right? Assuming
Yeah.
English or some other oral language, right?
Mm-hmm.
So that from the start, we're arming the parents with all of the resources to give
Yeah.
this child both modalities, because you don't know which one's going to quote unquote stick for that kid, right? You
Mm-hmm.
also don't know if the kid has other diagnoses or other things going on. I have a couple of my students on my caseload at the School for the Deaf also had apraxia of speech. But because
Oh.
when you have a 3-month-old, you can't tell that they have apraxia of speech, right?
Yep.
And so the parents were told to focus on oral language, and so
Mm-hmm.
they focused on oral language. And then when the child was old enough to produce speech and wasn't producing any speech, they had no way to communicate because they only
Mm-hmm.
gave them one option, and that child
Yeah.
couldn't produce that language because they had apraxia of speech. So you don't know what else could be going on. The child could have autism. The child could have some other diagnosis that they would benefit from having a sign language. So why not give them all of the tools from the start instead of kind of guarding, right? And like picking as the adult, you are going to pick what that child gets. No, give them everything and let their brain decide which one, if not all of them, that it wants.
Oh, for sure. I know there's some, well, I don't know personally, but like I've heard there's families that won't do cochlear implants like right away, and that's like something they want the child to make that decision. Because they're like, we don't, like, maybe they do want to be part of the deaf community. Maybe they do want to be a part of the hearing, or both. And giving them, like, they'll have the hearing aids and that kind of support throughout the early years. But, like, cochlear implants, they're big. That's a big surgery and things like that. So I was like, wow, like, good for you. Like, good for you to sit there and, like, let the child just have that ability to be like, oh, no, like I really want to embrace the deaf community. I really want to embrace ASL. Like I would sometimes rather not hear people. Like
I think, you know what? I think it's really hard for hearing people to wrap their minds around the idea that sometimes deaf people don't want to hear. Like they don't want to hear. And that's totally fine. Like we hear and we think that that's the only way to do it. No. Deaf people are perfectly fine not hearing. They enjoy it. So why do we have to push our assumptions onto them, right? Like we would assume that they want to hear like we do. No, what if they don't, right? We have to kind of accept that that's fine for them. They that's how that's all they know, right? Like that's how that's how they've been raised and how they have experienced the world. And so they enjoy not being able to hear. So why do we have to push our kind of assumptions and desires onto them, right?
Oh, for sure. Yeah, I think it's just, and I don't know, I think that's like how our world kind of is right now. Like we're just like in our life of like, okay, like I'm a female, I'm English speaking, like this is the way to go. Like I'm hearing, but it's like there's so many other routes, and you have to, like you don't have to know everything about the other routes, but just like acknowledging that, okay, like some people, they enjoy doing ASL. They would rather not go and get a hearing aid or a cochlear implant because they're like, no, like this is my community. This is where I belong. Like if people outside of it want to communicate with me, we will do that. But it's very, or just write everything down, text it. I know I listened to a book recently that the main character was actually deaf, and their main mode of texting or communicating was through text. So she was like learning signs when they'd be like one-on-one, but then they would go maybe out to like dinner or something where it's a little bit harder. So they would like text back and forth or across the room or something. And I was like, yeah, I mean, like we forget, like technology is so big right now, and being able to just text and like we can utilize that. It doesn't have to be face-to-face verbal communication. Like
you don't have to get like hung up on one particular modality.
100%. Yeah, it is it's amazing just once you get to that point of kind of letting the rules of school, I think, go. Where there isn't one size fits all, and you need to like instead of going in, I mean obviously standardized assessments and all that you need to do for kids, but I think the biggest thing to do is like, yes, find out where they're struggling, but then also find out where the families would like to go, and where the patients would like to go, where the clients, like whoever you have. Because I can sit here and recommend like for 6 months the same things, but if the parents aren't open to ASL, well then why am I giving them 10 ASL signs every time I see them? Like just opening that up and being like, well, what would be best? Oh, well, we would rather, I don't know, work on or like English. Like, oh, yep, I'm working with your child on these English words. And they're like, we'd rather them learn Russian or Spanish. And I'm like, oh, well, that would have been good to know 4 months ago. Like, and just really embracing people's lifestyles. Because I mean, whether I agree with them or not. Like, I am here as a therapist. I am here as a middle person, and I'm not here to judge you for the decisions you make with your child or your parent or whatever it might be. Like, I'm just here to make sure that the decision you do make is as easy, like the process is as easy as possible, with what I'm capable, of helping with. Yeah. Another question. So I have had, I think we kind of talked about this before we popped on. My little kiddo who like parents would celebrate when like she would wear her hearing aid for 2 hours a day. And she had them like for a while, but like what would be your recommendations if they did choose like the hearing aid routes and maybe even the child wasn't diagnosed until after they were walking, like 1 or so? Like, how do you introduce the hearing aid as like a normalized piece to this child and like get them excited about wearing it for longer periods than 2 hours a day?
That's a good question. Honestly, I kind of would prefer not to force a child to do something that is clearly not what they're not okay with, or that they're clearly like not taking to. I would recommend trying to put it on as often as you can, but if the child is resisting a lot, like I've seen a lot of kind of anecdotal stories from parents that the kid will blow up and throw the hearing aid and scream and cry and the whole day's ruined. So if that's kind of the response you're getting, then I would kind of pick your battles, right? And like, do we want to force this technology onto a child when they so clearly are troubled by it, right? And thinking about how we might give the child a little bit of agency, right? Even at a young age, they are trying to tell you that they don't like something. So as much as I would recommend trying to put them on as often as possible, also keeping in mind, like, how can I give my child a little bit of kind of agency and autonomy to be able to advocate in whatever way they advocate. It might just be like screaming and crying, but they're advocating that that's not something that they want. So what other thing might we try to introduce to kind of get them the language that they need? Because again, the issue here is that we don't want to force one particular modality. We want to give them every possible way of communicating. And so if they're making it very clear that this one modality is not a preference of theirs, then how can we kind of change our approach, and what else can we do?
Yeah. Oh, for sure. Yeah. This little girl, she was the funniest thing because like she would wear them like for short periods of time. So you would think like she would not love it at all. But I'd be like sitting in a session and she would go like grab the hearing aids off the chargers, bring them to mom, and mom's like, okay, well, let's try put them in. And she wears them for 10 minutes. Then she takes them out. Mom's like, I don't know, like she's showing interest, right? Like I saw that, you saw it, and I was like, yeah, like she knows where they are. She goes and finds them, and she'll like give them to mom and like point to her ears, like she knows what they're used for. And I mean, I think one of the recommendations I gave her was like becoming more aware, like even like books on maybe kids wearing hearing aids, or I know like Is an American Girl, aren't they starting to do like hearing aids? And I'm like, I don't know, maybe that just because I can't imagine really how hard it would be like as a child, like kind of being singled out and doing that without it being kind of normalized. So the fact that you could have, I mean, I think the same thing goes with different races and nationalities of like, people might not be treating you differently because of it, but just on the inside, you kind of get that feeling. So I know that's why I think American Girl has been doing really good at like doing multiple races and nationalities and disabilities and really making it more relevant and accepted, and helping these kids be like, oh, people are thinking of me like this. I'm not unique. Well, you are unique, but not in a bad way.
Right.
Yeah. Oh, for sure. Kind of, do you have any advice for speech pathologists working with these families on how, I know we have kind of talked about a lot of different ways that we can support the families. Like providing resources. I love that you're like provide them all at like 3 months of age, because that's the big time to do it. Like, or I guess what's maybe if these families are deciding to switch it up, like the child, they get to be so old and they were like, oh, I want a hearing aid now, or I want a cochlear implant. Like, how do we help those families like through that process of transitioning?
I mean, my advice to families is that we can listen to what the kid is telling us. Like you said, if they're older and they're saying, okay, mom, now I want to try the hearing aid, then go for it, right? Okay, mom, now I want to see if a cochlear implant is right for me. Let's go to the consultation and talk to the ENT. But I think if we think about even the younger kids, right, the little babies, the infants and toddlers, I would highly recommend to SLPs trying to find ways to get deaf adults involved in these parents and families' lives. Because one of the biggest things that I've noticed, at least in our field, probably in other fields too, is that we often don't have the representation of that population as an adult in the kids' lives. So even if it were like an autistic kid, right? We should get autistic adults into this kid's life so that they can see that there are adults like me, right? And that mantra of nothing about us without us, right? So how can we get the adults with the lived experience into these families and into these homes so that they can help us understand, like, see, I'm an adult and I'm happy and healthy and everything's great. So like, don't worry that your kid has reduced hearing. That's not, it can turn into something really kind of positive. And I think for families to see those adults can be really, really helpful. So that's my advice.
Oh, for sure. And that kind of gets me thinking too, like as speech therapists, I feel like right now the norm for speech therapists is like you go to your office and like you do your work like in your private practice building, or you go to the hospital and you run around from room to room like working with all these people, where it's not the norm to go out in the community. Like I was just recently talking to someone too with they work with individuals with aphasia, and they're like, we go to coffee shops so they can practice ordering and stuff like that. And like the fact that these kiddos, like, we can provide service, like we can provide our services and be like, let's go to a deaf community event. This thing's going on during our session time, or let's not do our session on Tuesday morning. There's an event on Friday, or there's this meeting or something that we can go to, and provide those kids like with a community and that support, and just seeing other people of like, oh yes, like other people are deaf, other people are hard of hearing, other people do use ASL, and like I like them, I want to continue doing this. And then they get older, and then that's when they become really immersed. And so like that would be such a great tool to do too. And I mean, personally in Las Vegas, I don't know if I know Minneapolis had a really big deaf community and they would always have events, and I went to a couple of them, but down here I don't know too much. I know they have like a Hands and Voices for especially families going through like the initial diagnosis and everything. And I know they put on like some events, but I think that one's more for like the families. Okay, now our child has a moderate hearing loss. What do we do? And they support. So I feel like those events are good, but they wouldn't be the same as like a deaf community event. Yeah, it's not immersing yourself per se. Yeah. So kind of going in listening devices. What are kind of different types of listening devices, or even what are they? Like I know hearing aids, cochlear implants, those are the two big things that you hear.
So hearing aids and cochlear implants are probably the more common ones. There's also something called a bone anchored hearing aid, a BAHA, which is for conductive hearing loss. So it vibrates the mastoid bone on your skull, and you can essentially listen through bone conduction. So those are the three biggest, I would say. Hearing aids, which is essentially you're listening through air conduction, but it's just amplified. cochlear implants, which is the surgery where you have an electrode array that is directly stimulating your auditory nerve. And then BAHAs, which allow you to listen through bone conduction. So for somebody with a conductive loss. And so, of course, each of those you would differ in candidacy based on the type of hearing loss you have, the degree of hearing loss you have. And so somebody who's a candidate for a BAHA is not necessarily a candidate for a cochlear implant. And as you potentially lose more hearing, maybe you become a candidate for a cochlear implant if you used to have hearing aids, that kind of thing. So, so you're going to see kind of variation in the type and degree of loss in what device would be recommended. But those are the three kind of big, most common devices that you'll see.
Okay. So if they, like, I guess, especially for families kind of starting off, like, would you recommend, like, start with the hearing aids? And unless obviously someone tells you, like, nah, like, this is deeper than hearing aids, like, we would have to go a step further. But would you recommend, like, start with hearing aids and then move into the BAHA cochlear implant sector, like, if needed or if the child wants? Because, I mean, I feel like once you do those two, it's hard to go backwards and be like, oh, let's just do a hearing aid.
So the BAHA is for a different type of loss. So if you have hearing aids, then you won't necessarily be a BAHA candidate. So if you've ever worked with a child that has like atresia where they don't have pinna, right, or they were born without a pinna or something, or they're born without an ear canal, so that outer part of the ear is missing, but the middle ear bones and the cochlea are still functioning, then they would be a BAHA candidate.
Okay.
Or a kid who just has kind of your typical sensory neural hearing loss, depending on the level, most of the time the recommendation is to start with hearing aids. If they have really, really profound levels, like if you have a kid who's born with profound hearing levels and will not benefit from hearing aids because you just can't amplify it loud enough for them to benefit, then you can go straight to cochlear implantation at a very young age. Like I've had kids in my school for the deaf that were implanted when they were like 9 months old. So it just kind of depends on the degree of hearing loss and the type of hearing loss and what the parents want to, like if they want to put their 9-month-old through a surgery.
Okay, with the BAHA, could that be done as early as like 9 months too, or do they recommend later or earlier?
Yeah, you can do the BAHA. Actually, I don't know what the FDA recommendation is, but you can do it young. I'm not sure exactly what the month age is. Yeah. But for implants, I believe it can go as young as 9 months.
9 months, yeah. That's like mind blowing to me because I mean it seems I've never seen one or anything like that, but like it seems very intensive, especially for like a 9-month-old, because you're going in and putting the electrodes in there for the auditory nerve. Yeah, that's a lot for a little 9-month. That's just like, I'm just trying to intake calories right now. Open my eyes, see what's going on around me. Oh geez. And I know we kind of talked about a couple misconceptions as well that are maybe a little more like generalized to kind of the makeup of our brain. So like the ears are the doorway to the brain. Is one of them. Can you explain more about that one?
Yeah, sure. This is one I hear a lot, right? And again, it's based off this assumption that the only way to take in language is through your ears, which we know is not true, right? You can actually take in language through your eyes, or you can take in language through your skin, right? Because tactile sign is it's the same thing, right? You're still getting that language input to the brain, but you're actually getting it through your skin. So this idea that the ears are the only way to get language into the brain is just not true. And by framing it in this way and calling the ears the doorway to the brain, you are placing that modality above all others, right? Like the ears are the most important. This is the only way to do it. It's the best way to do it, right? This is the doorway to the brain. Well, no, there are other doorways to the brain, and we can't just ignore them just because we prefer the ear, right? And so I find this kind of phrasing really misleading, and also kind of insinuating that one modality is better than the other ones, which is not true.
Yeah, and I love how you talked about like tactile too. Like and the person I think of, like Helen Keller, like that is how she learned to communicate, because she did lose the sight, she did lose the hearing, and they were able to figure that out. And I mean, I wish I could say like Helen Keller's the reason I'm a speech pathologist, like working with these people. I wish that was my story, but like as a kid, like I really looked up to her, and I think I didn't know why either. I was just like, I went to like the plays about her. Like if Helen Keller play was anywhere around me, like I was going to see it. And I was just like, oh my gosh, like she's so cool. But I don't think I really like sat down and was like, why do I find her so fascinating? And like now I look back on it, now that I'm a speech pathologist, like working with deaf and hard of hearing kids, I'm like, gosh darn it, this could have been a cool story that like Helen Keller brought me to this career, but it's okay. I can maybe like make things up and make it up that she was, but yeah, it's, I think that's a big thing too to know, because I mean, I had a kiddo who was blind, and trying to communicate, and he was delayed in language, and we would sometimes do like, okay, like just try to do signs like in his hand. And it was very interesting though. It really concerned me when I started seeing him, because he got transferred to me, and I was like looking at the goals, and I can't remember word for word, but it was something about communicating via signs, like with mom and dad. But they didn't say anything about like tactile or anything like that. So I'm like, was this other speech therapist like trying to communicate in ASL with this blind child? And I was like, oh no, like please tell me I'm reading this wrong. Like this. So I had to like explain to the parents, like, we're probably not going to target a lot. Like you don't have to do signs anymore, because that's not going to benefit this child that can't see the signs. So yeah, having even them too be like, okay, yes, we don't have to take out signs entirely, but maybe move it to their hand so they can feel it, and they might come up to you and like do the sign in your hand, and that's how they'll learn. Because I think we underestimate how easily it is for these kids to learn and how smart they actually are. Because I mean, you don't know it until they hit like 5 and they've like acquired all these like bad habits and the bad words and stuff, and you're like, oh no, like what did I do? And so I think that's just such a good thing to work on too, is just all these different modalities, like using all of our sensory processes. And even like for maybe autistic children that are more sensory, maybe signs out here aren't going to work, but maybe if you go on their hands, like that's what's going to stimulate them and be like, oh, this is how we're communicating, and just opening up these doors to not just, oh, you can only do A or B. Like, or you have to do like, you're from an English speaking household, like we're going to do English. Like, I think that's, such a big thing. That's, I mean, leaving this podcast, like I want everyone to hear that, is like, be flexible with the kiddos and the families. And like, it's not textbook anymore. Like you can still learn things from textbooks, but I feel like I haven't picked up a textbook in how many years? And like, I have learned so much more in the field. Everyone said I would, but it is. But I mean, even though talking with you and like starting this podcast and talking to all these people, and I'm like, mind blowing. Like I've been working with this clientele and had no idea. Like, like, it's so amazing once you start connecting with people and learning all these different modalities, that you just really are like, wow, like we knew our field was broad and people go in like specialized, but even knowing in those specialized fields, it can still be very broad, because
more specialized.
Oh, for sure. How about last misconception? The hearing aids and cochlear implants will fix the hearing.
Yes, this is a huge one.
Yeah.
I have heard people say, if the deaf or hard of hearing child is wearing their device and the hearing loss persists, then, well, of course the hearing loss is going to persist. The hearing loss doesn't go away because they're wearing their devices. That child will be deaf or hard of hearing every moment of their life for the rest of their life. Yeah. Wearing the device does not make them hearing. So with hearing aids, they're still going, this is just amplification of sound, right? So they're still going to potentially mishear things because it wasn't loud enough. And you can't just turn it louder because then you start to distort the sound. So it can only go so loud. And so they're still going to miss things. They're still going to mishear or misperceive things. They might hear, you might, let's say the phoneme S and they perceived it as an F, right? And you don't know that they perceived it that way, but they did. And so they're going to mishear, misperceive, and missound all the time, even with their hearing aids on, even with all of the therapy and the training, and right? And with cochlear implants, because you have an electrode array that's inside the cochlea, you are essentially hearing through a man-made device, right? You're not hearing how we naturally hear. And so your brain has to learn to interpret that electrical stimulation as language, as linguistically meaningful. And some kids are able to do it and their brains are able to learn that and make sense of it. And other kids, their brain is not able to make sense of that input. And so we have to remember that just because we've done a surgery and we've put an electrode array into their cochlea, it doesn't mean that they are automatically able to hear and understand language like the rest of us. It's just like with any other device that you would implant into a body, right? A pacemaker, a deep brain implant, right? Like anything, even like an amputee, right? Like if you have any sort of tool or man-made device that you're trying to interface with the human body, there's going to be things that you have to consider. The body might reject it. It might not work well with your body. It might be hard to adapt. Like there's so many things to think about. Just implanting someone does not mean that they're going to be able to hear and understand language like a hearing person. I think that's one of the biggest misconceptions that we really have to try to bust.
And I mean, you see this even with like the geriatric population once their hearing starts to go, and it's like just because they have a hearing aid in does not mean they're going to hear anything, like everything and anything. Like, like my grandpa, he still has it on like 100, and you walk in the room and you're like, I'm getting blown out because it's so loud. Yeah, I think that's, and like we kind of talked about too, of like battery life, like maybe the batteries are running out and like or maybe they turned it off because they were like, I'm done with all you people, like this, I need my space. Because I can see too, even with like this population kind of enjoying that sound, like that's what they're used to. That is, I mean, it's like me, I need sound. Like if I'm working, I need something on in the background, and if it's too quiet, I'm like, oh, what's going on? Where some of them might have the opposite, where they're like, there's too much noise. Like I need to just be myself for a little bit and like turn it off. And I think there's like a movie I saw once of an individual that just like in the middle of like this gathering just like turned off their hearing aids and was like walking around, and they're like, oh, Joe, like why aren't you talking to us? And he's like, oh, can't. Batteries are dead. Like
blame it on the hearing aids. I love it. I wish I could do that sometimes, you know? They get really loud, and I just wish I could not hear something for just be silent for a little while, you know? So, I mean, we have to kind of try to understand their perspective, right? That they might enjoy not being able to hear. They might enjoy the silence. They might not want to use their devices, and that's okay. As long as they have another language to express themselves. So
for sure. Well, kind of to round us out, an organization that is near and dear to your heart that you want to kind of highlight on this episode, what would that be?
Well, I'd like to highlight my own organization.
Of course.
It's called Language First. We are a team of deaf and hearing professionals, both in the communication sciences field and in other parts of deaf education, that advocate for early accessible language for deaf and hard of hearing kids. And we talk a lot about ASL English bilingualism. So please feel free to check us out on Instagram, Twitter, Facebook, and our website is languagefirst.org, and that's 1ST, so language1st.org. And we have lots and lots of resources for professionals. We also have lots of ASHA CEU opportunities, webinars, asynchronous courses. So if you have deaf and hard of hearing kids on your caseload and you want to learn more, please feel free to check out our CEUs.
Nice. That's awesome. Yeah, it's amazing. Like once I started this, I'm like, I'm learning so many new things, like of all these resources that people have made, like experts have made. And I'm like, I had no idea. Like that was just so easily like one search engine away. Like, but I think that's kind of hard with our time now. Like post COVID is like there's so much online that you're like, what's right? Like,
Right.
what should I be using?
True. Yeah.
Yes. What about a book? What book would you recommend to a speech therapist to read?
Yes. I highly, highly, highly recommend this book called Language Deprivation and Deaf Mental Health. So it's by two editors, Dr. Neil Glickman and Dr. Wyatte, and then each chapter is written by a different researcher or professional in deaf ed, and it goes in depth about all of these concepts we've been talking about today, about how having hearing aids and cochlear implants does not guarantee the child will acquire oral language, and how to implement ASL English bilingualism, and what happens when a deaf child doesn't acquire a first language, and how that can affect other things later in life, like their mental health and their quality of life and all of these things. So I really like it because it offers a really nice, comprehensive kind of read about all these different aspects and issues in deaf ed and working with deaf kids.
Oh, that's amazing. And I think, most of the books I've gotten, it's like with the population. Like you just, like we've talked about, like immersing yourself in just really reading books about it, like watching speakers that either have the disorder or that speak the language or whatever it might be. It's like you learn so much from that. I'm sorry, my cat is just she's being very needy right now. She's probably gonna like meow a couple times. Like she's been meowing like right by the microphone, so I'm like, it's probably gonna end up in the podcast. But awesome. Well, thank you so much, Kimberly, for hopping on today. It was so fun to talk to you and get to know you and the profession of that a lot of people might not be super familiar with. And congrats on Language First. It sounds like it is an amazing resource. And I know I was kind of looking on Instagram yesterday and I was like, oh my gosh, like there's so much here that I need to like save and pin because it is really, it's easy for us to implement these into our therapy services. It's just having the knowledge to do that. I think is the biggest thing.
Thank you so much for having me. This was a great talk.
Yes, of course. You're welcome anytime. Thanks, Kimberly. We'll talk to you soon.
Bye.